Welcome to the Human Momentum Podcast. I'm your host, Erik Schabert. I created this podcast to leverage 12 years of osteopathic medical training and over a decade of experience in primary care medicine to help sort through the confusing and sometimes contradictory health information found on the internet. I want to distill all this information down to a form that you can use every day to optimize your health as you move forward through life. So if you are looking to get to life's finish line with the ability to do the things you love intact, then this podcast is for you. If this is your first time here, please don't forget to smash the subscribe button and throw us a like as well. It really helps us get this information out to more people. With all that said, let's move on with today's episode. Hello and welcome to today's episode of the Human Momentum Podcast. Today, I want to have a discussion that's a little bit of a departure from some of my recent episodes. There's going to be a little bit less discussion of specific studies and medical evidence. And I want to relay a little bit more of my personal experience as both a physician and a patient moving through our medical system. All of this was really triggered by a recent episode from a podcaster that I have followed in the past and have a great deal of admiration for. His name is Chris Williamson. He posted an episode that discussed a lot of personal health issues that he was having. And it triggered some memories of some things I experienced with previous patients and some things I experienced myself with regards to our medical system, how things function, and some of the things going on in the US right now. Without getting too in depth into it, Mr. Williamson talked about having come down with a set of symptoms a number of years ago that included chronic fatigue, brain fog, poor sleep, and a myriad of symptoms. He went through a lot of diagnostic procedures and testing initially without a lot of answers early on, and eventually came to some functional medicine specialists who made diagnoses of Lyme's disease exposure and black mold exposure. And he did investigate his home and found evidence of black mold being present, underwent a long period of remediation where he had to live in a motel room, spent a great deal of money pursuing intervention after intervention after intervention. And my understanding is, to this day, he is still experiencing a lot of the same symptoms that initially caused him to go down that pathway, despite undergoing a lot of testing, a lot of different treatment interventions, a very aggressive supplement regimen, attempts at trying to stay healthy and fit. He is a young, fit guy and was at the time that these symptoms originally came on. Now, I want to make very clear the reason I want to talk about this case isn't because I have any critiques of Mr. Williamson and the interventions he pursued, or even the physicians that are treating him. It really is to talk about the experiences I had with some of my patients and to maybe give a little more information for individuals who run into these kinds of issues, because they are common, and maybe hopefully point you away from some things that may be very costly and not helpful, and potentially point you towards a pathway that may get you to a better place. For those of you that are tuning in for the first time, my background was I ran a practice for over a decade that combined traditional family practice, general care medicine, something that would look very similar to many of you who go to your doctor and get treatment for high blood pressure, elevated cholesterol, pediatric illnesses, a lot of very common issues. That was about half my practice. And for the other half of my practice, I treated individuals who had chronic musculoskeletal pain, and I did that primarily using osteopathic manipulative medicine. I had an additional board certification in addition to family medicine in something called neuromusculoskeletal medicine, which made me a specialist in osteopathic manipulation. For those that haven't had any exposure to DOs in osteopathic medicine, the approach I was using would look similar to some people who have gone to a chiropractor, but there would be some rather distinct differences too. I did not put much value in realigning the body or saying something was misaligned or out of alignment. I focused on when available motion was deficient and attempting to restore it, or when neuromuscular control patterns seemed to be disrupted and attempting to use both the interventions I did and referrals to physical therapy to try and correct those deficiencies. So, with that as a background, I did have a number of patients I treated who began to suspect that they had had exposure to Lyme's disease because they had either been in areas that where it was endemic or they had read something online and suspected that they had these problems. And I would frequently order testing for such issues. There was a physician in my area, a medical practice, that one of their areas of specialty was treating chronic Lyme's disease. And so I would on occasion test patients. And the guidelines that are out there for diagnosis of chronic Lyme's are very nebulous. And you will see practices that specialize in using criteria that are much more broad and symptom based, less based on laboratory testing. And one of my frustrations with this is I didn't see a lot of patients getting significantly better due to Lyme's disease treatment. There are other similar bacteria that cause a condition called anaplasmosis, and another one called ehrlichiosis that are more common in Florida. And I did have a couple of instances where I diagnosed these, and individuals did a straight up 14-day course of antibiotics and they got significantly better. And that was very divergent from my experience with Lyme's, where much longer courses of antibiotics and numerous types of supplementation and adjunct treatments, sometimes even individuals going for prolonged IV antibiotic treatments, didn't seem to produce those same kind of results. And these kinds of interventions could be quite expensive and very rarely, if ever, were they going to be covered by health insurance. I saw similar things with black mold exposure. Obviously, black mold is rather common in Florida, especially after we've had hurricanes come through, homes are damaged, there is water leaks. And while I very much believe that black mold can cause health issues, particularly respiratory issues, and there is even some potential for them to cause ongoing immune issues, I believe that adequately remediating the home environment is usually going to be enough to end this. And some of the rather heroic interventions that I saw with oral and IV antifungals did not seem to really produce results in patients. The official stance of the medical establishment in places like Mayo Clinic, the American Academy of Immunology, and other official organizations is that ongoing immune-related diseases from chronic disease, from Lyme's and black mold are uncommon, usually do not benefit from antimicrobial treatment, and there is very limited, if any, evidence for any sort of treatment interventions to produce results in those cases. I want to say I do believe that for most of the patients who are suffering from symptoms that gets attributed to these conditions, there is some real physiologic problem ongoing. I just don't think that we've had sufficient research to identify exactly what that is and what interventions are likely to be beneficial yet. And as such, I would caution patients who are going to want to pursue some of these very heroic, very invasive medication interventions for these diseases to really be intentional about considering this, because I just haven't seen a lot of results with it. And these are all interventions that have a strong potential for adverse effects. It's hard for me to be overly critical of patients who do decide to pursue these interventions, because I know they are suffering and they are looking for answers. And these are individuals who say they have answers and are, I think, in the majority of cases, trying to do something that will benefit the patient. And they believe they are doing something that will benefit the patient. So it's a difficult situation. I think the solution is more research and getting more answers. Despite this, as a physician who straddled the line between standard and alternative medicine, I still put a lot of value in the National Institutes of Health, the Centers for Disease Control, and our mainstream medical research. I think in the overwhelming majority of cases, it has led to us getting better answers, not worse answers. And I have seen just as many ineffective and poorly directed efforts on the fringes of medicine and in the alternative medicine community as in the mainstream medicine. I was fortunate enough to train with a mentor by the name of William James Brooks, who is an osteopathic manipulative medicine specialist. And Dr. Brooks has dedicated his career to trying to find ways to move manipulative medicine in a direction that is much more evidence-based and generates reproducible and applicable research results. I think we need more of this in every branch of medicine. And I want to put forward a message of compassion towards individuals who are suffering from issues that don't fit neatly into our modern diagnoses and are simply searching for answers on the fringes of medicine because the mainstream doesn't really have their situation figured out yet. Well, that's my message for today. Thank you so much for tuning in. And if you would be so kind as to subscribe and put a like on this video if you found it helpful, if you like this message, go ahead and share it with people you know. And I will see you next time.